Hello, I'm Dr. Casebolt. This is Dentistry and You. I'm glad to present a very, very important issue. It's about our aging teeth. It's about the individuals in our society that we call our mature adults. I like to call them our silver citizens. They are our people that have worked year after year after year and have survived, have saved their money, have worked hard, and now are in the golden ages, maybe the silver ages of their life. What's more important is their aging teeth. When I was 25 years old, I had young teeth. I am 35 years old and they aged 10 years. 10 years from now, I will be 45 years old. And 10 years from that, I will be 55 years old and my teeth will continue to age. This is one of the things that happens. We do age. And that's, in fact, a very good thing because that's part of life. That's part of us. That's part of being human. And our teeth age. Our health ages. And part of being healthy is recognizing this fact. Now, about 12% of our society are silver citizens, mature citizens. Citizens, as I had described before. They require very important consideration because they are a growing part of our society. Now, with me today is Carol Morris. To the left of me, she is a registered hygienist and also a very important administrator of Dental Care 50, a very important part of a program designed to help those people who are 50 and over. Carol, and thank you for being on Can't See Alive.
Thank you.
Next to Carol is Dr. Greg Peppes, a very good friend, close personal colleague, a general dentist, and an individual who has worked with this program and understands the needs of those people that are 50 and over. And again, I want to welcome both of you to Kansas City Alive.
Thank you.
Thank you. Carol, one of the things I'd like to ask you as administrator of this program called Dental Care 50, what do you provide, what does your organization provide for those people 50 and over, and what do you see in the future for our silver citizens, our mature citizens?
Our dental service is strictly for people 50 and older, and we offer reduced rates, anywhere from 30 to 60% savings. Most people care about their teeth but don't like to spend the money. Dentistry is the last thing you'll spend money on. I've never given a talk anywhere where people said, I love going to the dentist, because nobody loves going to the dentist. The biggest fear in dentistry today is cost. That's the number one fear. It has nothing to do with drills or root canals, but it's cost. What is the cost? And by our plan, we have a set fee schedule, so you always know what the cost is going to be. And if you're 50 and older, or if you're married and one spouse is 50, you can join our plan and get the reduced rates.
Well, I think that's wonderful because I find this true in dentistry. Generally, a lot of people don't know. They come in, doctor, what is it going to cost? My gosh, how much am I going to have to spend? There's always this big if, and there's a great concern about that. And I think that the plan very specifically explains and at least assures those people, our silver citizens, mature citizens. I like mature citizens. That's so much better. I like grandma and grandpa, but we'll go with silver and mature citizens. Okay. Dr. Peppes, as a provider on this plan, what are your concerns, what are your interests, and how do you see the treatment of these patients and their needs?
Well, for one thing, we're seeing a lot more of our mature patients coming into the dental office than what we used to. Statistics show us that people are living longer and keeping their teeth longer.
Yes.
So in doing so, we've got to be able to take care of those properly. As Carol had mentioned, people are concerned with the rising cost in dentistry, but we've done a considerable amount in dentistry to make it as painless as possible. The new innovations with the new types of handpieces, x-ray machines, things of that nature, so people don't have to be afraid anymore of how much pain, discomfort that's going to happen. The thing we don't have a lot of control over is the cost, but with Dental Plan 50, we're able to curtail the costs little by little. But getting back to what we need to do with these mature type people, it's essential that these people, in retaining their teeth for a longer period of time, have problems later on in life with their teeth, as far as breaking, as far as losing them, dentures wearing out, having to make new ones, this type of thing. So it's essential that they get the care that they need.
Well, I think that's extremely important, and I couldn't think of a more important issue for more important people. And I might also mention, this is a call-in segment. For our viewers out there, our silver citizens, our mature citizens, if you have a question either for Ms. Carol Morris or Dr. Peppes, please call us. By gollies, we'd sure like to hear from you, because we maybe have the answer for the question that you have. Dr. Peppes, I would say, Greg, if I may.
Sure.
I'm sure that you see a lot of periodontal needs in our aging people, and there's an extreme need for that. What do you provide within the needs of the plan that cover these issues? And these are very important issues for our people.
We do a lot of education. I think it's extremely important that the patient understand what is periodontal disease, why are they getting it at this point in time in their life. Gosh, I've gone 30 years and I've never had a problem. All of a sudden my gums are receding, my teeth are falling out. What's happening to me? I think what needs to be done first is to educate them, to explain to them what is periodontal disease and what we can do for them. Periodontal disease being, I think a lot of people are used to the name or familiar with the name pyorrhea, being a bacterial type infection in the gum tissue that eats away at the bone and tissue to the point of the tooth actually falling out.
Right.
It can be maintained, it can be, I shouldn't say cured, but what we can do is clean it up to the point where the patient can retain their teeth for a long period of time.
Right. I think that's very important, and I find that periodontal disease is more of an issue for our aging people more than anything else.
They're wanting to keep their teeth as long as they can.
If they beat the tooth decay issue, they've gotten to the periodontal issue, and I think that's extremely important.
Right.
And along those lines, Carol, I'd like to ask you, I know that the fee is so extremely reasonable for this. I know if I ever make it to age 50, by gollies, I'd certainly like to be on this plan, because it would assure me that I was getting not only a good deal, but I would be comfortable with what I was being provided with, my experiences, what I could experience at a Dental Care 50 provider. What does it cost for someone to join Dental Care 50?
The cost for Dental Care 50 is $55 per year, or $100 per couple. That covers cleaning, x-rays, your initial oral exam, oral consultation, oral cancer exam, fluoride, local anesthetic, second opinions, the list goes on. It's about $80 worth of dental work for the initial fee.
More than that, easily.
Well, the average in Kansas City is about $80. So you're ahead of the game just with the enrollment fee.
Sure.
And then we provide a membership card. You can pick a dentist and specialist anywhere throughout the Kansas City area, which Dr. Peppes is one of our providers, and receive a 30 to 60% discount on anything else you need. Any work, anything from root canals to fillings to crowns, bridges, dentures, denture relines. It's all included in our fee schedule.
That is fabulous. That is absolutely excellent. Again, I would like to advise our viewers out there, if you are a mature citizen, if you're over 50, please give us a call. I would very certainly entertain your phone call, talk to you. Ms. Morris, Dr. Peppes would certainly like to entertain your questions. I think specifically, and I'll address this to you, Carol, amongst our needs, and we know that the population is growing older, much older. I will live older than my mother. I will live older than my mother before her. That is a legacy of high-quality medical care. And this is very, very important, because as we live older, we have other and more important needs. Not only medical needs, but dental needs. And we've got a phone call. Please go ahead. You're on the air. Please go ahead.
Okay, I had a question about, can you choose any dentist at all in the area once you join the plan? Or is it only selected dentists?
There are selected dentists and specialists throughout the Kansas City area. All the way from up north of the river to Belton, east and west in Johnson County. plus a list of specialists. So all the dentists on our plan are...
Do you know about how many you have?
We have 22 dentists and 17 specialists.
Okay, great. Thank you.
Well, that covers a wide variety of things, I'm certain. Is there any other questions?
On to somebody else. That's exactly what it looked like.
Well, I think that pretty well covered it, and thank you for calling. Dr. Peppes, of all the things that you see with our mature citizens, what would you say is probably the most important aspect of their treatment, their needs, and what they need?
Well, as we talk here about people becoming more mature, the likelihood of patients also develop problems as far as oral cancer, which everyone is concerned with. I think it's important in the mature adult that people have a tendency, once they get set in their ways and getting dentures and thinking that they not have to go back to a dentist again, kind of take it for granted that it's essential that they periodically have checkups, even like physicals.
Yes.
We need to go in as a dentist and check around inside the mouth to see if there's any problems that may develop that they may not be symptomatic to. Oral cancer is a thing in dentistry that we really haven't been able to have the leaps and bounds of improvement as what other cancers throughout the body has had. And the reason behind it is that we're not able to diagnose it at an early stage. The reason being not being able to get the mature adults into the office when there's not a problem to catch it at a stage where it can be treated properly. So I think this is an area of concern that people should be aware of, and it's essential that they seek dental treatment on a regular basis for no other reason than to be checked and make sure that they're cancer-free.
So what you're saying, and probably an important issue, just because someone has dentures, they are not free of dentistry.
Absolutely not.
They have dental needs. They could develop neoplasms, we call them, cancerous lesions of the mouth. If detected early, these lesions can be dealt with in an effective manner and can save a person's life. And that is so very important for our denture wearers that are part of the mature patients. And I think that's extremely important. I would make that issue also as well. And again, I'd like to express to our audience out there, if you have a question, give us a call. We are here to answer your questions if we can. We will not diagnose your problems, but we will answer your questions if you have one about our aging citizens. And I just was notified that we have a call. Please go ahead. You're on the air.
What kind of services do you provide for the denture wearers?
Carol, I'm going to go ahead and let you answer that.
In our enrollment fee, we cover, you have your dentures checked, your mouth tissue checked, your bone dentin checked. By checking your mouth, you can also come up with different types of anemia, diabetes. It's an early warning system through your mouth, which doctors, MDs do not check mouths, and dentists
they look right down the hatch.
Dentists don't check bodies, and your mouth kind of opens up a whole myriad of different diseases and things. And I go all over the city and talk to AARP groups and senior housing groups and just wherever. And I have people that literally come up to me all the time and say, I haven't had my dentures checked in 40 years. And they are so proud of the fact that they haven't been to the dentist in 40 years. But the dentures don't fit. So we check relines. And to me, one thing you learn in school is you have dentures, you get your dentures checked, and this is part of your well-being. How you eat, how your dentures fit, is your basic nutrition.
Absolutely.
And if you can't eat right and your teeth hurt and your dentures don't fit, then your general nutrition will go down. You'll eat soft, mushy, starchy foods, and it's just a vicious cycle. You don't eat right, you get sick. So,
I think that's so very important. I think there's a denial amongst denture wearers that kind of says, hey, I've got dentures, I don't have to worry about it, no problem. Yeah. They work okay, they don't feel so okay, I can deal with it.
No, they feel very comfortable.
Yes, they do.
And when they feel comfortable,
and then they can't figure out why their gums and their teeth come together so far and they are loose. And I think that's an important issue to address to our silver citizens, our mature citizens, that just because they think everything is okay, it not necessarily is. What you don't know can hurt you. Greg, Amongst your patients that you see on the Dental Care 50 program, what is probably the most important issue in terms of treatment, and what do you see the most? I know you see a lot of denture patients, I know that's true, but I find amongst my mature patients that many of them require periodontal treatment, not necessarily severe comprehensive periodontal treatment, but periodontal treatment that's of an ongoing basis. In other words, reevaluation, deal with what we've got at this point, and how to go on the next upcoming years.
I think at a specific point in people's life, when they finally get their kids out of college, they get to a stage in their life where now it's time to take care of myself.
So you see a lot of reconstructive
and they come into your office and they've had some teeth that have been neglected. The gum disease isn't rampant to the point where it's hopeless, but it's to a point, well, you know what, if we can get on the wagon, teach good oral hygiene, get them going on a good oral hygiene program, things can do real well. I see a lot of patients in that situation where now it's their turn for them to come in and to become restored. Not only just periodontally speaking, but maybe a filling that had fallen out a while ago, or a tooth that may have cracked or fractured, and now it's time, let's get these things fixed. We welcome patients like that for the pure and simple reason, once we put them, I guess you'd say, back together again, you find yourself a whole patient that's a lot happier.
I can imagine that's very true, and what a wonderful procedure, what a wonderful service that is for our mature citizens. Carol, how are our dentists reimbursed? I know that they're reimbursed not only from the heart for doing this, but not only that, but they get a good reputation. And the reputation factor is important because you list these doctors as human individuals, human caring dentists that say to the public that, yes, I want to take care of our silver citizens, our mature citizens, and make a statement that I want to take care of them and make sure that their teeth are okay.
I think one thing with the dentists on our list that are participating dentists in Dental Care 50, none of them really participate in any other program other than maybe one other carrier. On a whole, they're not much for programs or plans, and they feel like if they can get the patient in and give them the work they need, and our plan covers, well, an example, porcelain crown on our plan is $260. Normally you'd pay about $400. We also have 2 implant specialists on our plan.
That's tremendous.
Cosmetic dentistry is covered, which most plans it's not. And I know Dr. Peppes has seen a lot of people that want the cosmetic dentistry because, like you say, okay, the kids have the braces off. Can we go ahead and take care of my smile? And it's possible because dentistry itself in the past 10 years have made wonderful advances.
Tremendous advances.
So the doctors are still getting paid. They're making money.
Yes.
You couldn't ask a dentist to join a plan and make no money. The doctors are making money.
I think so.
But there's not the 7-time markup off that crown that is the usual and customary case. And people are appreciative. They finally get back into the office, and oral hygiene is the whole point. And the dentist would rather have somebody in the chair paying something than saying, I can't afford it and I'm not going to the dentist at all.
Exactly. If we have another phone caller out there, I would certainly entertain their call. Do we have someone there?
Yes.
Yes, please go ahead.
How do you find, other than the yellow pages, how do you find a good specialist in in dentures? I'm a younger person that lost him in a football accident, and how do I find a good specialist?
Carol, you're
total
the one to
dentures
ask.
with a prosthodontist or a partial?
No, they're full dentures. I lost about 8 or 9 teeth in a football, landed on some cleats.
Okay.
And when I was about 16. And so I've worn them
full evaluation.
for some years.
Wouldn't you say, Greg, full evaluation?
Do you have a denture now?
Yes, full.
Okay, you have a full denture now.
Lost about 5 teeth off the bottom and 4 off the top. How do I find someone that really does a good job rather than just the yellow pages?
Well, Dr. Peppes does an excellent job. Dr. Casebolt does a good job. I can recommend both of them. For a prosthodontist, which is a denture specialist, I would refer to one of the dentists.
Yeah, well, as a general practicing dentist, I do have certain prosthodontists which I refer to when there are instances which I feel that are a difficult restorable case or a case that's that you don't see ordinarily. A lot of times your general dentist that you can go to can give you some guidance. There are special prosthodontists that are board certified in a specific field that they only make dentures, and they make I guess you'd call them difficult dentures that may be from accident victims that maybe have a lot of bone that's been lost or misplaced or something of that nature.
I think the important thing, and especially for our viewer, is that for most instances, most cases, most of us general dentists, especially those participating on the program, the Dental Care 50 program, are quite capable of dealing with these problems. And again, I want to thank Ms. Carol Morris and Dr. Gregory Peppes for being with us on Kansas City Alive and Dentistry and You. And again, I'm your host, Dr. Casebolt, and thank you for watching Kansas City Alive.
Stay tuned. When we come back, you'll find out what's on Wednesday's Kansas City Alive.